welcome back to PHAMCAST. I've been sitting here with a good friend, a cherished ambassador, and my behavioral optometrist, Dr. Carolyn Teske. You know, I love having you on the show, but I just love catching up with you because I'm always learning, always growing, and always I just get fired up when I see someone else with similar passion in their own field, which is so cool. And one of the things I'd love to really talk about when it comes to eye health, you always say the eyes are a window to your body and to your health. And in fact, on February the 17th, during Preventative Health Awareness Month, February 17th is Eyes Are the Window to Your Health Day. And you're going to be giving a lot of education through blogs, through this kind of type of education to really help people understand the importance of their eye health, not just preventatively, but how it impacts other diseases impact eye health and vice versa. But I think there's a big disconnect for a lot of people not understanding, you know, you're a behavioral optometrist. What does that actually mean? And can we talk about the role of the brain and vision?
Absolutely. The eyes really are an extension of the brain. And when you look at vision that way, then anything that impacts the brain will impact vision. So, you know, in more traditional kind of optometry, we would really treat only the eyes. And if your eyes were good, then your vision must be good and you should see another healthcare practitioner. Behavioral optometry really encompasses looking at the whole body in terms of proprioception, in terms of movement, in terms of, you know, the processing that happens between eyes and the brain, which certainly impacts vision.
Yeah, and so absolutely, and also has an impact on all ages and stages because, you know, you often say to me, I mean, I get some of the best glasses, but there was a time like I had 20/20 vision, I had the best vision, my kids would laugh at me, my arms weren't long enough at some point in my life, and you keep telling me that I'm getting a promotion, which is one of the fun things of aging. But let's talk about it that way a little bit, that behavioral optometry, the role that it can play in health at ages and stages of life. Like, give us some real examples, Dr. Teske, of how, you know, behavioral optometry can really impact somebody's health and well-being at different stages.
Well, even from birth, right? You know, primitive reflexes are really important at ensuring that the visual system develops as it should. So we're talking about the baby crawling on the floor and passing toys across the midline instead of just to one side or the other. You know, then the toddler learning how to walk, and the preschooler who really probably doesn't know what he's missing if they don't have good vision because that's all they've lived.
Right.
So we initiated the ICI Learn program,
yes,
which is our incentive for JK students to have their eyes tested. And thankfully, you know, thanks to the government and the Ontario Association, the visits are covered, so the eye exam is covered and glasses are provided, so there's no barriers to health for anyone. So really we want to prevent problems rather than react to you know, a challenge academically in grade 2 or 3 and the teacher says, maybe Johnny should have his eyes tested, right? So,
and not just academically, that's really important, of course, but also behaviorally.
Absolutely.
Or, you know, it shows up in different ways because of the frustration and the inability for the child to articulate why this is happening, right?
Sure.
It starts to look at the why instead of just here, you know, your eyes are fine.
Yeah, avoidance is one of the first signs to watch for in terms of poor vision because it's too much effort for them to really, you know, see properly. So they're quickly distracted, right? So ADHD and ADD, often those labels are set to students who really have a visual problem that's not been diagnosed.
Wow. And then as we progress through the lifespan and, you know, as we get older, behavioral optometry and various techniques that you use and cutting edge technology, both diagnostic as well as treatment, tell us some of the other people that could benefit from maybe not the typical eye exam, but what they might experience at an office like yours.
I think more and more every day we're seeing, you know, light therapy and energy work, you know, with microcurrent. All of those technologies and tools can have a place at all ages and stages. So, right, especially light therapy, you really can, you know, use the eyes as the input to the brain, and based on the color that you use, really reset the nervous system.
Oh, it's so cool. It's so cool. So when, you know, if somebody's suffering from PTSD, or they've got anxiety and depression that is really severe. What does it mean? I believe it's called Syntonics.
That's exactly right.
So Syntonics, tell us and everybody at home what Syntonics does, and maybe share a success story, because I've witnessed it through your eyes, and it's really remarkable.
You know, I mean, light is powerful. I think everyone acknowledges that.
Yeah.
You know, in the wintertime, many patients struggle because we don't have, you know, natural light. But light, depending on the wavelength that you use,
Right.
can really make significant changes to, you know, your nervous system. If we're stuck in fight or flight, you know, then there's no possible way for us to be able to be focused and to be attentive to task and to not have headaches or to truly be healthy and well. So one example, I would say, a young patient was really struggling with headaches and migraines and trouble focusing, could not drive herself to get to work. So she did, I think, 20 sessions of light therapy. You know, the coolest part, I think, is you really don't have to participate in this treatment. All you have to do is show up.
Like,
so
what
we
can someone
determine the
expect?
wavelength, and
Yeah.
you literally either use, you know, filters and look at a stimulus of light, or you stare into a tube to a certain wavelength, and depending on the patient, could be 5 minutes, could be 10 minutes. But there, other than showing up to the appointment, there's no homework,
Wow.
right?
Yeah.
So that is how powerful light is, that you can really reset. So happy end to the story, drove herself to work, back on track, you know, functioning in a high stress type environment. I didn't see her maybe for 2 or 3 years. And then life came back and she got stressed again and she needed a little touch up. So I think she did, you know, maybe 10 weeks. But it's an ongoing relationship, so that if she needs the tools are there.
Oh, it's amazing. And what it does is it really, pun intended, opens up your eyes to the various things you can do that's empowering, instead of just, not that there's anything wrong, there's a time and a place for pharmacology, there's a time and a place for talk therapy when someone's depressed, but sometimes we get caught on this hamster wheel and we're not seeing progress. It's frustrating to the clinician, it's frustrating certainly to the patient and their family. And when you can interrupt the system, literally, through techniques and therapies like Syntonics, it's really a game changer, which is really cool to watch. And you've seen a lot of that with different
Absolutely.
people in your practice.
And of course, her symptom often was vision.
there you
right?
go. So
You know?
tell us about that. Like what would her vision present like?
Just not focused, right?
Right.
There is an epidemic right now of nearsightedness, and I think we can thank devices for that, which we can't do without. And I no longer say don't use devices,
Yeah, right.
but I think our key is to teach what devices do to the eyes and what you can control and what you can do to help prevent problems from device use.
Okay, so while you were right on that, because one of the moments I always do on FAM is stock the toolbox literally. So when you talk about, yes, it's hard, you can't get the device out of a parent's hand, let alone a kid's hand. It's part of our culture now, our existence. So what are a couple of tips to help with eye health and preventing eye strain or issues, dry eyes, things like that? What can you do from a device perspective?
I think, you know, the 20-20-20 rule is certainly very, you know, current. Every 20 minutes, blink 20 times, look away 20 feet for 20 seconds. You know, basically take a break.
Right.
And I think, you know, if really we had the best case scenario, children under 10 would not be on devices, you know. And I think the pediatric recommendation is for 11 to 17 in that tween group, for every half hour that you're going to spend on a device, you should spend a half hour outside. I really like that idea.
That's a really
right?
great idea.
Imagine if adults could do that.
Yes.
If we're 8 hours on the screen,
Right.
could we spend 8 hours outside? We'd be healthier.
Absolutely.
But, you know, anytime outside.
Right. Now, and you also, and I love this tip, but I'm going to let you share it, on the device, on the phone itself, there are settings that people may not know about. Can we talk about that so that we can help ourselves, help our eye health, and in return prevent things like from headaches and eye strain and dry eye and all the things?
For sure. Well, of course, your apps will monitor how much time you're spending.
Yeah,
I always get a little
that's a
bit
bad
afraid.
reminder.
I get a little afraid when I see that you've spent so much time on your phone. But there also is a setting under the settings feature that it's an eye health module, and it will alert children, particularly who like to do this. You and I are doing this, but children like to do this. So it will alert you if the device is being held too close.
I love that. And you can also change the the light in the evening. You told me
Absolutely,
to get on.
you can put a blue light
filter on it.
Yeah, the night mode is a blue light filter.
So tell everybody why. Why blue light, Dr. Teske?
So again, if you think of the body as a whole, we believe that blue light impacts the circadian rhythm and our melatonin levels, which of course impacts sleep. So really there shouldn't be any device use, 2 hours ideally before bed.
Right.
Establish a good bedtime routine, and hopefully, the device could be there for noise, for sound, for the alarm, but it's not you scrolling.
Yeah. So I think it's so refreshing when I talk to you, because you talk about the eyes, and you certainly know issues in the eye. You certainly have the best technology. You're a great clinician in terms of, diagnosing and acting. And I just heard you were just telling me last week, you had a heck of a week, because you've had, I think sometimes people don't realize optometrists can be the front line of defense in emergencies. Can you quickly just share how people, it's not just, yes, have your eyes checked. Yes, make sure you can see for things like driving and what have you. But you often have to get into action, and it can be life-changing or saving.
Yeah, and sometimes life gives you all of those events in
all
one
at once.
day. So, the nervous system, MS often is diagnosed in an optometrist chair. Even though the patient may have had years trying to get a diagnosis with other symptoms, it's pretty pathognomonic for pain on eye movement to be a cardinal sign of MS. So the nervous system, the circulation system with stroke, right?
Yes.
So, the carotids are the main blood supply to the eyes and the head. So if we're getting ischemia or lack of oxygen to the eye and or to the brain, that's stroke, and vision often is impacted. And I think on that day I also had an actual eye problem. We had a retinal detachment, which again is ocular emergency. So I have the privilege of treating patients, and I love that, and I really enjoy what I do. But some days when you pack all of those urgent cares together, it's a lot.
Yeah, and it must be incredibly rewarding, because you change people's lives in the course of their lives, and saving someone's vision or their life as a result of doing what you do with the lens that you do it in, which is to be really integrative. Because I would argue and that sometimes we stay in our lane and our silo, and we don't think outside that box, and then no, you need to go see your doctor or what have you. You always go that extra mile, because you do think integratively, which is why you have been one of the OG ambassadors from the early days. Just before we finish up this segment, and we've got one more. It always goes too quick when you're here. Honestly, we need more time. But one of the things I also love about what you do is that you actually practice. And I hate practice what you preach, because I'm not preaching. You implement what you educate on, and you often make, just like I do myself, the own guinea pig, and then figure out, well, is this real? What's the science? Does it work? And then you share it. And yet you continue to do that for yourself and your own well-being. Can you give us a couple of examples when it comes to eye health and the nervous system in the brain of some of the tools in Dr. Teske's toolbox that she tells others to do? And we're gonna, in the last segment, really roll up our sleeves and talk about some diseases and how the eyes can be reflective of the disease or what it can impact. But what's in your toolbox?
Well, I think as I have more birthdays, Margaret, then I need more tools in the toolbox. So the tools keep changing, but certainly vagal nerve stimulation has been a tremendous tool in my world.
Yes.
So cranial nerve 10 controls so many things: breathing and heart rate and respiration rate. So all of those things. But most importantly, what it does for me is it just takes me off that super stressed mode.
Yeah.
Increases my sleep. So with Dolphin, which is that microcurrent device, there's an apparatus that attaches to your trachea, right? So in front of your ear, and I put it on my arm, and I literally, at the end of the day, for 10 minutes, just let this current run through my body.
It's incredible. Yeah, it's a game changer, and I use it personally as well. I've used it with hundreds, thousands of patients. I've introduced it to many doctors, optometrists, other healthcare professionals. But what I think we love about it both the most is that it's accessible. Many extended health insurance companies are now covering it because it is a Class 2 medical device recognized by Health Canada for home use. It's based in science. It combines acupuncture that's been well studied and microcurrent. But what the best thing is, it puts it in the hands of everyday people to integrate it into their daily lives. But what I like the most is when I'm talking to a practitioner who's using it for themselves and what a difference it can actually make. You can feel, see, and experience the difference.
Oh, absolutely.
In under 10 minutes.
Yeah.
Literally drops, the autonomic nervous system.
Tremendous.
Tremendously, quickly. Drops inflammatory markers. Really helps when you tonify the vagus nerve, you reduce inflammation. When you tonify the vagus nerve, you increase circulation. So it's a really cool way, and it's really neat to see that you are actually educating on it, but then actually using it. What else is in your toolbox? I know something you tell me beside my toothbrush every night, thanks to you.
Yes. So yes, I think that's going to be engraved somewhere on my tombstone. Get up, brush your teeth, which is irrelevant. Well, it's important for your
oral health, which is important,
but not
yes.
eye health. Well, maybe it is.
Yeah,
because
bacteria,
it impacts the lymphatic
inflammation.
system.
Yeah,
for sure.
Here we go.
So after you brush your teeth, because most patients don't forget to do that. That's why I add the brush your teeth. Put your eye drops in,
yes.
right? Take your omegas as a supplement, and I do that every day. So I think rather than react to dryness, we don't react to dryness. You don't wait till your lips are cracked before you have water to drink, right? So I think waiting till your eyes feel sore from all that device use, because they will be drier. That's why we want you to blink and look away 20 feet. Then prevent the problem.
Right, exactly. That's awesome. Well, thank you. I love to peek in your toolbox because I'm always interested, in finding other new tools because I want to share them with all of you. I want in on it. So that's really neat. So we're gonna come back in a minute and we're gonna dive in and really look at some of the common illnesses that everyday people are facing, from diabetes to MS to cardiovascular disease to lymphatics and immune system. The eyes play a role, and Dr. Teske will return here in a minute with me, so stay tuned. We'll be right back.